structure of the lumbar vertebra. So here we know that this is the cervical region, anterior, posterior, okay, anterior, posterior, cervical region, thoracic region, lumbar region, sacral region, and coccyx. So in this lumbar region, we'll be having vertebrae L1 to L5, L1 to L5. Total 5 vertebrae will be there. In these 5 vertebrae, L1, L2, L3, L4. These 4 are same. These 4 vertebrae are one party, okay. These 4 vertebrae one party, and L5 vertebra will be different. So what it means here, L1 to L4, these all vertebrae are typical lumbar vertebrae. That means all will be having same features, and L5 is the atypical vertebra. So it will be having little structural variations compared to these vertebrae. Okay, now first we'll see these typical vertebrae. After that we'll see atypical, mean L5 vertebra. So if we come to normal vertebra, lumbar spine. First we'll see body of the vertebra. So here the body of the vertebra here. See here, same like our lumbar spine, same like our cervical spine, here body of the vertebra, the transverse diameter of the vertebra is more compared to the anteroposterior diameter, same like cervical spine, here also the transverse diameter of the body of the vertebra is more, it is more compared to the anteroposterior diameter. That's the one point here. So this is the one transverse diameter, and one more point here, anterior diameter is more compared to the posterior diameter. That means suppose if we take one vertebra here in this arch of the vertebra, okay, this arch of the vertebra. So here this is anterior, this is posterior. So if you come to lumbar spine here, anterior diameter will be little more compared to the posterior diameter. This is anterior, this is posterior. So it is more compared to the posterior, that we can see in the lumbar spine. Okay, this is about the body of the vertebra. Now if we come to pedicles, these pedicles are the pedicles which are present in lumbar spine. These pedicles are short. Pedicles are the short, okay, short pedicles will be there, and very thick, short and thick. That's why I draw like this, short and thick pedicles will be there. Now if we come to laminae, okay, lamina. So this lamina also here short, lamina also short and broad here, okay. The shape here will be short and broad, okay, okay. This lamina, this pedicle. Now if we want to draw lamina, first we have to draw this spinal canal, okay, spinal canal. After that here we'll be having transverse process, we'll be having transverse process of the vertebra. After that here we'll be having articulating faces, here we'll be having superior articulating faces. After here we'll be having spinous process, okay, spinous process. This is the lamina here, short and broad lamina we can see in the lumbar vertebra. And if we see facets, okay, facet joints, this we discussed already. Facet joints orientation, backward, upward, medially. Facet joints orientation, here superior faces, behind this we can see inferior faces, backward, upward, medially. And orientation, it will be in the sagittal plane, so that because of the sagittal plane orientation of the facets, here we can get movements, flexion, extension movements will get more here. And one more special here, facets, body over, okay, pedicle, lamina, and facets. In this facets, if we see C-spine, cervical spine, we saw one special process on the body of the vertebra, that is uncinate process. That means here body of the vertebra will be like this, so it will be the body of the vertebra. Here we can see uncinate process. So these are going to helpful in the lateral flexion restriction in the cervical spine. If we come to lumbar spine, here we can see mammillary processes. Mammillary process. These mammillary process, we can see it's like a very small bumps. We can see just behind, if this is superior articular facet, just behind the superior articular facet we can see this mammillary process. What is the use of these mammillary processes? These mammillary processes are going to helpful. So this view I will show in a superior. Suppose this is our body of the vertebra, we are seeing posteriorly. So here this is our superior facet, here also we will be having superior facet. This is the transverse process of the vertebra, here also transverse process of the vertebra, and then this is the inferior facet. Here again this is the inferior facet of the vertebra, Then imagine this is our spinous process. Now we are seeing vertebra posteriorly. So if this is superior facet, here we can see mammillary process. Just behind the superior articular facet. These are going to helpful for the attachment of two muscles. First one, multifidus muscle, and second one medial intertransverse muscle. So to give attachment to the multifidus and medial intertransverse muscle, here we will be having mammillary process. Okay, this is about the facet joints. Now we'll see transverse process. So if we take transverse process, here the transverse process of the lumbar spine are long. These are the long transverse process and extends horizontally. See here, already I draw here in this horizontal. See here, these are going to extend horizontally like this. Okay, extend horizontally the transverse process of the lumbar spine. And if we see spinous process, so here thick spinous process, we can see the spinous process are thick, and this spinous process also like extend horizontally like transverse process. This also like extend horizontally like transverse process of the lumbar spine. And here one more special is there, that is accessory process. processes. These accessory processes are nothing but the bony which are small. These accessory processes are small and irregular bony prominences. Small and irregular bony prominences which are present over the posterior surface of the transverse process. Suppose this is transverse process present over the posterior surface of the transverse process. Posterior surface of the transverse process. These are also going to helpful for the give attachment to the multifidus muscle, and at the same time medial intertransverse muscle, intertransverse muscle. So same like here we'll be having, if we see facets, here is a mammillary process, same like that here accessory process which are going to present posterior to the transverse process. These will give attachment to the multifidus and medial intertransverse muscles. Here if we see mammillary process which are posterior to the superior facet joints, these will also give attachment to the multifidus and medial intertransverse muscles. And last one we have to see vertebral foramen. The vertebral foramen, see here, the vertebral foramen which we are seeing in lumbar vertebra. Here the vertebral foramen is large in size compared to thoracic vertebra. Vertebra size is foramen size is large compared to thoracic vertebra, and small compared to the cervical vertebra. So here foramen compared to thoracic large, compared to thoracic small. And shape of the vertebral foramen, here it is triangular shape. So cervical spine, in the cervical spine vertebral foramen is triangular shape. In thoracic spine vertebral foramen is ring shape. In lumbar spine foramen size is again triangular. Here it is a large size, here it is a large size, here it is small size, again here it is large size compared to thoracic, but this large is less compared to the cervical region. So this is about the characteristic features of the typical lumbar vertebra. So whenever we are seeing one vertebra structures, first we should see what is the body of the vertebra: pedicles, laminae, facets, transverse process, so spinous process, here accessory process, here this lumbar spine it got, and then vertebral foramen. So this body we can say it's a anterior part of the vertebra. Remaining all we can say in one heading, that is arch of vertebra. So we have to see, when we are seeing the vertebra, first we should see what is the body of the vertebra, then arch of the vertebra. Inside the arch only we are getting this structure is called pedicle. This is vertebral foramen, this is transverse process, this is laminae, this is pars interarticularis. Here we can see superior facet, inferior facet, and spinous process, again transverse process. Clear?